Okay, good morning. My name's Maria Madden, and it's 10:30 on the dot. So my mom and dad always said that if you aren't a couple minutes early, you're late. So we're going to start right at 10:30. I know that makes some of my colleagues very happy. But I wanted to cover a few things first. And the first and foremost thing is thank you for spending your time with us. It's a lot going on and a lot of change. So the fact that you can take some time with us to learn a little more about the cliff effects, we really greatly appreciate that. My name is Maria Madden, and I have the joy and privilege of serving this community by working at United Way of the Piedmont. It'll be 3 years on the 10th of July. And time, it goes by fast when you're having fun. So I really enjoy my work here. And part of that work is donor networks. And Women United is one of those donor networks that we have here at United Way. I also have some colleagues on with me that are helping put on this event. I am going to introduce a couple of them, and then at the end of this, we'll turn it over to the third one, who will then introduce our panelists. So first and foremost, I wanted to invite Mary Narati and Alex turn on their cameras for a second so that people can see your beautiful faces. Mary Narati is over our events here at United Way and has had to learn how to go from doing in-people events to virtual events. So thank you, Mary Narati, for helping me get this all set up and going. And then Alex Moore is our Senior Director of Marketing here at the United Way, and she is our tech guru. So she is going to keep us afloat while we do this United Way. And I also have to give kudos out to Alex. You're gonna see a video here in a minute that she also is able to create for us. So thank you, Alex, for doing that. I will also say that Alex and Mary Narati are going to be supporting from the fact that if you have any technical difficulties or if a colleague reaches out to you because they can't log in, I'm watching my screen here, but they are the ones that are actually trying to help. So please feel free to use the chat and or Q&A down in your bar. You should be able to move your mouse over your bar and see that. And it will be Mary Narati or Alex helping to jump on those questions, not pertaining to content, but necessarily pertaining to technical difficulties. So thank you all very much for that. And speaking of, we are going to be using the Q&A, which you should see. You can ask a question. And if you want to ask a question there, or you can use chat. We're going to be using both of them to be able to answer your questions. Since this is a webinar type event, then what that means is you'll hear and see from panelists, but we won't necessarily be able to hear or see from you. But please use the questions and chat. We will work to answer as many of those questions as possible. But if we aren't able to get to it during this time, because we have a lot of information to cover, we promise I will have all the information and be able to get back to you through after this event is over. And we are recording this event. So when this is over, you will get an email from me with a link to the recording should you want to go back and watch any of it or listen to it again. I think that covers all the housekeeping that I have. And with that, I want to make sure, Alex, I didn't miss anything that you would want me to throw out there.
I don't think so.
Okay, good. So then I'm going to turn it over to Hannah Jarrett, who is our Director of Financial Stability here at the United Way. And Hannah, you take it over with cliff effects. Thank you very much.
Morning, everyone. As Maria said, my name is Hannah Jarrett, and thank you all for joining us this morning. I'm going to share just a quick overview of what the cliff effect is. And I'm also joined by some panelists and guest speakers who will share about the issue of the cliff effect and how it impacts our community from their perspective. So we'll hear from Shanadia Singleton, who shared her story through video about how she has experienced the cliff effect and how that has impacted her and her family. We also have Sierra Fowler with the Spartanburg Housing Authority, as well as Jessica Brown and Mira S. from Denny's. So I'm excited, and I thank all of our guests for joining us. And again, like Maria said, please put your questions in the Q&A box as we go, and we'll try to get to them. So to start off with, I am going to try sharing my screen so that I can show you what the cliff effect is. Let's see. I hope everybody can see my screen. It should be a graph of the kind of a graph image. So the cliff effect is essentially when it does not pay to get a job or to take a raise because the income or the wages are not greater than or equal to the amount that was lost in benefits. So if you're not aware, public benefit programs like SNAP and TANF and CHIP and Medicaid and Medicare and housing vouchers and childcare vouchers, all of those benefits are based on income. And so as your income increases, your benefits typically decrease or completely disappear. So this is an example because it's sometimes hard to understand if you haven't met someone who's experienced it or heard the term before. So we put together this example. So this is of a single mother with 2 children under the age of 5 in Spartanburg County. There's a lot of information on this graph, so I'll break it down for you. The red dotted line that you see is the self-sufficient level for this family. So this means that it's going to, this family needs to be bringing in $3,500 a month in order to afford basic needs. Hold on, I guess it's not in slideshow view. I'm not a super expert of Zoom. I did click this. Is it in slideshow view now?
Now it's working.
Okay, sorry about that. Okay, the 3,500 is the self-sufficient level. So that's the amount of money that's needed in order for this family just to afford the bare minimum essential basic needs. No more, like no extras, no savings, just housing, transportation, childcare, those types of things. And it goes from no job, so bringing in $0 an hour in wages, all the way up to $20 an hour. And the light blue lines at the bottom are the wages. So you can see when it starts at $8 an hour, and then it goes all the way up to 20, you can see that blue bar steadily increasing on the bottom. The different colored parts of the graph are different benefit programs. So again, SNAP, Medicaid, Medicare, childcare vouchers, housing vouchers, those types of programs. So let's look at $8 an hour. So this mother goes out and she gets an entry-level job in our community making $8 an hour. That, in addition to the benefits that she is eligible for, her family is self-sufficient. They're able to afford their minimum basic needs for the household, which is great. I think a lot of times you might hear an $8 hour job and think, well, you know, that family needs to make more, that's not able to help them. But that income, that wage does help a lot of families because they are able to still, in many cases, receive public benefits that then allow them to be stable, healthy families. So as you can see, as this progresses up, this family is able to be fairly stable and self-sufficient all the way up to $14 an hour. And it's when this family goes from $14 an hour to $15 an hour that we see the cliff effect. So as you can see here, even though this mother is bringing in $1 more an hour, she's actually losing over $500 a month or more in her household income. And she's below the self-sufficient level. So that decrease is impacting her family significantly because it means that she's going to have to make tough decisions like, do I pay for my rent or my food for my children this month? Or do I send my children to high quality childcare? Or do I hope that I can find a babysitter to keep them while I'm at work? Those are tough decisions, and that is a lot of money. To have a $500 plus deficit in your basic needs budget each month that's hard to overcome, and hard to overcome consistently. So that's the cliff effect. It would not benefit this family to make $15 an hour in this specific situation. And in fact, it wouldn't be until this mother went out and got $18 an hour that she would be back at that self-sufficient level to afford her family's basic needs. And I hope you can see from this that for this mother, it's the same for her to make $8 an hour in terms of income as it is for her to make $18 an hour. So there's not a whole lot of like incentive for her to really go out and get higher wage jobs and to be promoted. And it's not necessarily this mother's fault. She has the skills and the motivation and the ability to do it, but she gets stuck in these lower wage jobs because of the income eligibility requirements for public benefits. So that's a quick overview of the cliff effect. We're going to dive a little bit more into some of the specifics as well as what we're doing about it following our guest speakers. So I want to now turn it over to Alex to share a video of Shanavia Singleton. Shanavia is someone who experiences the cliff effect. She is the assistant director of the Bridget Green Street, which is a safety net provider here in our community. And she also served 2 years as an AmeriCorps member through United Way's AmeriCorps program. So I want us to take a few minutes to hear from her and how the cliff effect has impacted her and her family.
All right, I'm getting up. Can you guys see that video?
Yep. Yep.
Yep, okay, great. Make sure we got.
Shanavia Singleton. I currently live here in Spartanburg County, actually here in the city limits. I am originally from Sumter, South Carolina. So I'm a single mom and I have 5 children. I have a set of 3-year-old twins. My daughter is 6 and I have a 10-year-old and a 12-year-old boy. So 4 boys and 1 girl. I'm also the assistant director here at the Bridget Green Street. So you may start off in public housing because something happened in your life and you ended up in a situation where you needed housing. And they are affordable housing. However, once you get into public housing and you have no income, your rent can be $0. Some public housing requires you to pay a minimum of at least $50. $50 may not sound like a lot to some people, but for people that just don't have a job and have 0 income, $50 is a lot of money to come up with once a month. And especially if you have a baby and you got to get diapers and all these things that you cannot use your SNAP benefits for. So once you do have a job, your rent increases, your benefits decreases. So your child care will decrease if you have child care through DSS, or your SNAP benefits will decrease if you have that. Your Medicaid may even decrease, and that's medical insurance for your kids, while all this is decreasing and your rent is increasing. So your money, you just don't really, sometimes people just don't have enough money. So a lot of times people get stuck there and they want to just say, you know, why go to work if I'm going to lose all of my benefits? I don't want to have to decide if I'm going to be able to pay my rent this month or get my kid diapers this month, or if I'm going to feed my kids this month, or what are we going to do? I don't want to have to put myself in that situation. It's really hard. I've been there, and I've been there for about 6 years now. And while I feel like I'm okay and I have a great savings account, I just don't know what's going to happen if I find I'm not looking for another job. But if I was to say, for example, get a second job, that second job would cost me way more than the money that I'm gaining. It'll put me in a bigger situation. I could see me probably running through my savings if I had a second job. And that I don't want to do. That doesn't make sense. And who wouldn't? I mean, if I'm able to work a second job, I want to work a second job. Just because I have 5 children, I'm a single mom. But it's just not, it doesn't make sense to me. It doesn't make the best money sense to me. I feel like it affected my family because I know that I can work more and earn more money. While it's not always like about money, it's just like about my kids' future. And I want to be able to do more for them and have them prepared more for the future. But like, you just don't know if you're doing the right thing, or you could do more or be better, and you want to do more and you want to be better, and you want to go out and get that great job because you know you can do it, so that you can, you know, do better things and more things with and for your family. It was really hard, especially when my babies were babies, and I had a set of twins, and both of them are in diapers. And then you really don't want to come out to like places like this, or, you know, community outreach centers to get diapers, just because you want to say it for someone that really needs it, even though you're one of those people that really
Absolutely.
really need it.
Right.
You just don't want to do it. It's just, it can be really difficult to even try to decide how to do it.
Yeah.
And because you don't want the stigma attached to you because you receive government assistance, so you want to go out here and work and get money and things like that. But if you're not really ready for it and what they're willing to take for you, it's almost like you need a savings to start before you even start working under when you're receiving assistance. People look at people that receive government assistance as lazy, or, you know, they're just undeserving, or they just don't want to be this, and they're comfortable at the bottom. And that's not the case. They're stuck at the bottom. It's definitely a cycle. It's definitely a cycle because, like I said, the more money you make, the more money they take. And so it's just going to keep going. And I'm still going through it myself. But because I'm going through it myself, I can coach somebody else through it too. But it's hard. It's not easy. It's not easy. It's really hard knowing where to draw the line, especially when you're thinking about your income. You got to say, well, I know I can't work more than this many hours. It's really hard because you really want to do it, but it just doesn't make financial sense.
So I hope y'all were able to pick up on a lot of what Shanavia shared with us in that video about how much she has to make these hard decisions for her family, and to, you know, oftentimes sacrifice her own, you know, career and her own dreams in order to do the best thing for her family. And as she said, and I know that as I've also said, it just doesn't really make a lot of sense. And it's not something that you would, without really understanding the complexities of how benefit programs work, that they can sometimes, like she said, keep people stuck in the bottom, because that is what makes sense for the family at that specific time. So I do want to turn it over to Sierra Fowler with the Spartanburg Housing Authority to share a little bit from the Housing Authority's perspective. The Housing Authority provides housing vouchers to the community, which is a public benefit. And they're also, you know, as a housing authority, there to support their residents and to support their residents in becoming self-sufficient. So talking a little bit about that, because these programs and these services are designed to be temporary supports for families while they go through crisis and while they try to get back on their feet and try to be self-sufficient. And unfortunately, sometimes because of these negative consequences, it can backfire a little bit, and unfortunately sometimes for generations. So Sierra, I'd love for you to share a little bit about the Housing Authority, a little bit about how housing vouchers work, just so we can better understand the relationship to the cliff effect, and how you see the cliff effect impacting the residents and families at the Housing Authority.
Okay. All right, good morning, everyone. So Spartanburg Housing Authority, just to give you a little bit of history, has been in our community for 80 years, providing services for families for low-income housing. So providing affordable and quality housing, but also promoting self-sufficiency. So putting families on that path of self-sufficiency has always been our goal. So we have public housing, and then we have housing choice vouchers. So with our housing choice vouchers, it's based off the fair market rent rate. So if somebody has, for the example, with single mother with 2 kids, so she couldn't go out and get a 5-bedroom house. So if she has 2 girls that are close in age, then she might meet for a 2-bedroom home. And so it's based off of the fair market rate, so can't go above that. But also only has to pay 30% of the adjusted income that she receives. So they'll receive a voucher, and then they'll have to go out and find suitable housing, and also find an owner who is willing to take that amount of rent that the that the participant will pay, but also how much the housing authority will pay. So therefore, they can't exceed that fair market rate and try to make a bunch of money, because we want to make sure that it's affordable housing, but also we want to make sure that as we receive vouchers from HUD, that we're able to give out more vouchers for our families that are in need. So we have to balance it every month of the number of vouchers that we have out and the money that we have received from HUD. So currently we have about 2,650 vouchers that are out in our community. And also we have about 19,000 people who are on the waiting list for public housing and vouchers. So that gives you a little bit of information of affordable housing that is definitely needed right here in our community. The cliff effect, is interesting with the cliff effect as wages increase. It kind of outpaces the decrease of benefits. And so therefore families do not see the benefit, as Shanavia has said. So if we look at the whole family, and so we have seen with the cliff effect, especially with our vouchers families, they're moving to that path of self-sufficiency, they're moving there, and here they are, they're losing more of their benefits. And so they get to the point where now they're going to be losing their voucher. So basically when they hit HAP, which is their housing assistance payment, where they've reached that point of they're no longer considered low income, they have 6 months until they lose their voucher. And so people get there and then they'll say, you know what, I'll just quit my job and I'll hold on to this voucher, where housing also becomes a safety net. And so as the cliff effect comes, you think about the child and you think about the family. I now could afford childcare because I had this voucher, but now I can't afford it. And the money doesn't balance of what I'm receiving. To give you a couple examples, I was sitting down with a young lady, and so we were looking for jobs, and she was only looking for jobs at fast food restaurants. So this gave me a whole new perspective. And so I'm like, no, if you make this amount of money, we can look at these jobs. We have all these plants. We have all these things in our community. And we began to go through her budget and having kids. And so she's left over like $150 after each check. And she was like, who lives like this? I now don't have, do I pay for food? Do I go get other supplies for my kids? Do they get to go to a field trip? And I'm looking at her and I'm like, you know what? You are exactly right. And I'm stunned because I have no way to say you should work and take this job, because it gave me a new perspective of now I'm stuck. And if we look at our whole society, it's more than just housing. Families all over are having to make those very tough decisions. And that's where we also see homelessness begin to rise, and we begin to see how life happens or a pandemic comes. And so we have a lot of families for our voucher program where we've had to do over 200 research for families who lost their jobs and employment. And those are individuals that we're wanting to move towards that path of self-sufficiency. And the reality is, without the cliff effect in our community and we can move more people, then maybe we'll be able to pull more people off the waiting list who needs that hand up, who needs that opportunity to kind of get some things together and work with a case manager and a service coordinator, because we'll begin to move people to that path of self-sufficiency and they don't feel like they're stuck or what if life happens. And I think the overall in housing long-term effect is a ripple effect because it becomes generational. And those are also things that we also have to consider.
Great, thank you, Sierra. I think that was fantastic information to just share from your perspective, because I think that sometimes when we talk about the cliff effect, it can make the benefit program seem kind of like, they're the enemy, but that's not the case. These programs are designed to support and help families to success and to stability. So I think that the Housing Authority, Spartanburg Housing Authority, is a great example of that, and we appreciate everything that you do in our community to support those families. And I appreciate your example that you shared of how sometimes organizations, people can have the best think that they know the best for a family, like the example that you shared, to say, oh, let's go out and get you, a $15 an hour job, and that'll solve all your problems, and you'll be all set, and you'll be able to afford everything for your family. And then sitting down and looking at that resident's budget and her income and expenses, and it didn't make sense. And so it's kind of it's important for us as community leaders and organizations to educate ourselves so that we don't walk into situations with those assumptions. So I appreciate you sharing. And if anyone has questions for Sierra, please put them in the chat or the Q&A, and we'll come back to them at the end. But I do want to now turn it over so we can hear from the employer perspective on this issue. So we have two folks from Denny's joining us. We have Jessica Brown, who's the Senior HR Manager, as well as Mira S., and I'm not going to attempt to say her last name, but they are going to share a little bit about how they see and experience the cliff effect in their company and with their employees, and how they see that impacting their workforce. So Jessica, Mira, please introduce yourselves and share with us about your perspective.
Mira, I'll go first because you're a little closer to our team members that are affected by this, but I'll just say, well, first, I'm Jessica Brown. I've been with Denny's, will be 6 years this year in August. This year by far has been probably the most challenging for, because of things that have affected our industry specifically. The restaurant and hospitality industry has been heavily impacted by the pandemic. So it's been challenging, but the good thing about the restaurant industry when we're not going through a pandemic is we do hire a lot of entry-level team members. So the restaurant industry is one of those where you can join with no experience and work your way all the way up to higher levels. Our senior director of company operations started out many years ago as a server. So there's a lot of opportunity in our industry. And so I think we do have a lot of team members that are impacted by the cliff effect. We work really hard to move our team members up through our pathways, and sometimes they do get stuck in this cliff effect. And I think Mira has some good examples, excuse me, of team members that are in that situation. My position at Denny's is field HR manager. So I support the field operations. I don't get to work as closely with our restaurant team members, but I work closely with Mira and her peers. We deal with a lot of issues when it comes to employees, but development is one of those that we work hard on. Mira works hard on it, especially in the GSP area and Virginia area that she covers. So Mira, I'll turn it over to you to talk a little bit more about specific examples, just kind of high level of our team members that have run into this issue.
Hi everyone, I'm Mira. I'm a district manager for Denny's. I've been with the company almost 3 years in another month, and I came from California market, so I've seen a lot of differences to South Carolina market about a year and a half ago. So cliff effect, it's a huge impact on our business. I have such a talented employees, and a lot of them are single mothers who cannot step in a higher position just because they're going to lose the benefits. So, and when you look at that potential, it is sad. And I've seen a story, right, that was been shared before. It is absolutely true. The level of income they've been offered will not substitute the level of benefits that they would need to give up in order to take that position. But there are also an opportunity here, which I see a miss. You can start as a host and move your way up. And my personal boss, who is an amazing director of company operations, she started as a host, and 24 years later, she's running whole company units, right? So it's definitely somebody to look up to. And if you start in a host position, it's not that you're just going to move up to the shift manager. That's where you right in that rate of $15, $16, $17 an hour. You might not make sense for you to lose the benefit and step in. But there is a further position. If you take that step and go through the training and show your potential, which you actually have, you can step into the salary position, which definitely will put you in a self-sufficient category. I think that's the biggest step, but needs most support. All those talented folks do not want to step in into shift management and jump into restaurant manager position just because they're not sure if they can do it again. So I believe that's where support is needed, and maybe it's a temporary support that's needed for that year of a balance out to see if they can actually do. But that's where we would need to work together on, and in order to get them to that monthly level. And right now, I do have at least one individual who is in the position of shift manager, but cannot step into the salary with all her talent that she got. She's a single mother, simply because she does not want to lose the benefits. Even that for that temporary time before she gets to the salary position, she does not work enough hours, and she'll keep to no more than 25 hours in order her income level not to exceed. So I think that's the sad situation of amount of talent she has and then decisions she needs to make.
And I think what Mira is saying is once we get to that salary level, which is our restaurant manager, you can assume that you're kind of over that hump, because it pays very well. It comes with company benefits, health benefits, bonus. They should definitely be in a self-sufficient position at that point. But it's that in between when they're, we want to move them to that shift leader. They're still hourly. And also one issue that we talked about when we met with Maria and Hannah in the office before we all went remote is the hours. In the restaurant industry specifically, when you become a restaurant manager, you do have to work nights and weekends, and then you have the childcare concern as well. So that's another complication.
Thank you both so much for sharing from your perspective. Again, if you have questions for either one of them, please put them in the chat or the Q&A. How this is, oftentimes when we think about cliff effect, my first thought is about how it impacts that family, that household, and that immediate need. I mean, that it's heartbreaking to hear that families are having to make those tough decisions, but then the more and more you learn about it, I think that Jessica and Mira spoke to this wonderfully, is also a larger issue for our community. It's not just those individual families who are having to make these decisions and face these challenges, but it has a bigger impact from a workforce development, a workforce retention, a talent retention. I think that through Shanadia, Sierra, Jessica, and Mira, they all shared stories of people who are motivated and skilled and talented in their positions, but because of the way that these systems are designed and how they work together or don't work together, it means that it's not just that family who's losing out, but it's also our community overall and our wonderful employers and partners and the overall economic development of our community. So it definitely has larger implications. I'm not seeing any questions at this point that haven't already been addressed. But again, keep putting them in there. I am going to share a little bit about what we are doing, unless any of our guest speakers or panelists have additional comments they'd like to add. Sierra, Jessica, Mira, if you feel good, I'm going to move on to kind of how can we address this? This is a challenge in our community. We know it exists. There's lots of single mothers and single parents out there in our community. So what can we do about it? I'm going to share my screen again, and hopefully I do it better than I did last time. So let's see if I can get this pulled up. All right, you should be able to see the same graph again, demonstrating the cliff effect. And again, this is an example of a Spartanburg County single mother with 2 children under the age of 5 is this specific example. So now I'm going to share a little bit about what we're doing at United Way of the Piedmont. So we've done some research into this, some best practices for addressing the cliff effect that other communities and states across the country have done. And they're, like with anything, there are both short-term and long-term strategies that can be deployed to help families in these situations. We are very, very grateful in our community that we were awarded a gift from a corporate partner to start a Cliff Effect Fund pilot. This came after that company learned a little bit about the challenges and complexities of moving out of poverty and achieving self-sufficiency, and also knowing that our Women United group had selected the cliff effect and helping single mothers become self-sufficient as their focus area. So we were awarded some funds to pilot what we call a cliff effect fund. And essentially what this is, and I think Mira mentioned this in her comments about, can we have some temporary supports for families? And in the example that she shared, as they move from shift leader to restaurant manager, or from an hourly position to a salary position, and those families are facing the cliff effect, at risk of the cliff effect, and decreasing their overall income as they work kind of long terms towards a self-sufficient level. So that's essentially what this is. So the fund would provide ongoing long-term case management for single mothers as they are working towards that self-sufficient level, moving up career pathways through training and other ways that they can achieve that by providing kind of fill-in support. So for example, as families increase their wages and are no longer eligible for the housing voucher, this fund would help offset that difference and that loss to make sure that the family is able to remain housed and stable while the parent works up through their career pathway towards that self-sufficient level. We could also help with childcare. I believe that Jessica mentioned how critical childcare is to employment, as we all know, especially for single parents who are working full-time and have young children. And childcare is essential. It's critical for those parents in order to maintain their job, in order to be able to show up for work each day, knowing that their children are safely cared for. Without childcare, that it can become very challenging very quickly. So as families are working to increase their wages and no longer are able to receive that childcare voucher through DSS, this fund could help, again, offset that difference so that the family is able to remain stable. It can also help with food-related costs if needed. For most families, food is a much smaller budget item than things like housing and childcare, but can certainly help out with that as well. So again, our goal with the fund is to provide that short-term immediate assistance to families to, instead of having a significant quick drop of a cliff, making that a gentle slope instead, and making sure that as wages increase and benefits decrease, that everything still balances out and it makes sense for the family to do that. That would overall help that family in the long term, but also help our overall community and our overall economy as well, because it's keeping talented workforce employed. So that's the Cliff Effect Fund pilot. We first started this pilot right before the pandemic hit, and we had actually identified a handful of potential candidates for this fund. Unfortunately, those positions and those families were, in the positions where they were no longer employed or they were furloughed. And so this was kind of put on pause, but we're hoping, or we know that as folks start to re-enter the workforce and things start to become more normal, that this will become even more critical to help those families make those decisions. I also just want to share some other best practices that we've learned from across our country and other states and communities that are facing this. A lot of it is really under advocacy work. So especially when it comes to advocating for the alignment of eligibility levels for public benefits. So for example, I'll give you an example of that. Childcare vouchers is a huge support for families, especially if they have young children, preschool age children. The childcare voucher can pay the majority of the childcare costs. And those of you with children know just how much childcare costs. I think I was in a recent conversation and someone shared for some families, they're paying more in childcare than they would in college tuition. So it's a very expensive. Right now in the state of South Carolina, the eligibility requirements for that voucher is 150% of the federal poverty level, which is, fairly decent income range that families can receive that. However, it means that we're going to have the cliff effect. So the example that I showed you where there was that big drop from $14 to $15 an hour, that was because that family lost their child care voucher. So a lot of states have advocated that the eligibility for child care vouchers be increased to 200% of the federal poverty level, meaning that families would be eligible for that assistance longer. So that by the time they lost that child care voucher, they would have the wages that they needed to make up the difference, therefore eliminating the risk, eliminating the cliff, and therefore, again, encouraging, incentivizing employment over remaining in lower wage positions. Other things are programs and services that encourage savings and wealth building for families. Oftentimes, the self-sufficient level means that you're just paying and affording your essential basic needs for your family. However, it doesn't mean that you're able to save for the future or to put away an emergency fund or to save for your children's college education. It just means that you're able to get by month to month paying for your basic needs. So programs and services that really help families with budgeting, saving, doing individual development accounts, escrow accounts, those types of things are really, really helpful for families so that by the time they've kind of worked their way off of benefits, like Shanavia mentioned, they have that savings, that safety net, that personal safety net set up in place to help them so they don't have a domino effect that leads them back down into a place where they need benefits again. And then as both Jessica and Mira have mentioned with Denny's, how they have really good career pathway in place. People can start off in, entry-level positions, but then there are those structures in place to help those employees move up into salaried positions. We need to make sure that employers have those career pathways in place. Also, when employers understand the cliff effect, just making sure that they have that lens. I think Sierra's example was perfect in that just having an awareness of these issues helps us, better understand each other and better help each other move through these challenges. So those are just some of the best practices. I'm going to stop sharing my screen, and I think we have a few questions. So we can maybe address those as well. Please make sure that your questions are input. Go ahead.
And I just had this backup from your slide from a housing authority standpoint when we talk about escrow accounts. We have a family self-sufficiency program that we have through HUD. And with that program, an individual is able to have a service coordinator. So they have to enroll in the program. They have to establish goals. So their goals might be stable employment. It might be working on a budget. It might be credit repair. It might be home ownership. And as they're working and their rent does increase, that portion of their rent will go into a savings account. And so it's an interest-bearing account that we set up through a HUD-approved institute. And so that $50 will go into their account every month. And so they have to work on their goals. They have to complete their goals. And once they complete their goals, all that money is theirs. And so I think it's important that when we hit those cliff effect for great programs that you guys have created, that we're able to continue to partner. So when they do hit that cliff, we can help kind of get them over that cliff to kind of hit and establish those goals in order to receive those funds. We often have a lot of people, and they have $13,000 and $15,000 in their escrow account. And when they hit that cliff of, housing might change, my rent increase, childcare, everybody, really gets frantic, and they'll throw the whole $13,000 away, and that money goes back to HUD. So really just even educating our families of the supports that are right here in our community to help them on that cliff to go into a gentle slope, as you mentioned.
Yeah, and I think that that's a fantastic best practice that hopefully other organizations can use as a model to, again, make sure that families have their own safety net so that they can support themselves through those challenging times and those tough decisions, and perhaps putting them in a position where they don't have to rely on community safety nets. I think to your point earlier, Sierra, that then opens up our ability as a community to help more people who are on waiting lists and things like that. We did have a question about how long the Cliff Effect Fund will support families. The cliff effect affects families differently. It depends on a lot of variables, including what industry the person or the family or the parent is working in, how many children the family has in the household, the ages of the children. So there's a, what type of assistance and how much assistance they're receiving. So there's a lot of variables. So it is very much a case-by-case situation, which is why case management is such a critical part of this. We do have community resource coordinators who will be working with these families to establish goals, to help with budgeting, to help make sure that the family has the support that they need in order to be successful. But we anticipate that the average length of time would be anywhere from 6 months to maybe 24 months. Depending on that case-by-case situation and what they need. It is a limited fund, but we do want to not just create another cliff with the cliff effect fund. So it might mean that we're only able to serve 2 families with the fund over the course of 2 years in order to truly get them to the self-sufficient level. And that's fine with us. That would be success for us. This is definitely a program of quality over a program of quantity, because we also know that it's not just that one head of household that we're helping. It's not just that single mother. It's also her children that we're helping and setting up for success, because we're helping break that cycle of poverty, and that's huge. So that's a little bit about that. But if we were to do some more advocacy efforts, if we had more supports and more funding available, those are longer term strategies that could have even a broader and bigger impact in terms of just number of people affected. We had another question about how COVID-19 perhaps impacts and affects this work. It says the question was, how do you anticipate COVID-19 affecting your employees, residents, and community members? This seems intertwined with the cliff effect and those affected by it. And what are the plans to address this? I mean, I don't know if Mira or Jessica or even Sierra, y'all want to provide any thoughts on how you see COVID-19 impacting the people you work with as it relates to maybe some of the challenges we've just talked about.
Mira, I'll take a stab at it and you correct me or add in, or if I say something that's off. But I think right now, the impact is obviously the slump in business. That's obviously going to affect the number of shift leaders that we need, the number of hours that we have to provide, essentially our labor budget. The business directly affects the labor budget. So as far as the promotional opportunities, they may be more limited. I think we have a few more in the GSP area just because we were already understaffed pre-COVID. We did have to furlough probably 70% of our crew across the nation, just at our company units, but our franchisees had to do the same thing. So we have tried to bring back those employees first versus hiring externally. And so we're trying to get our trained Denny's team members back, but we've lost some of them because we can't provide the number of hours they're used to or the shift that they used to have that allow them, to work around their childcare needs. But we've gotten a good bit more back overall than I think we expected. So we're happy about that. We tried really hard to stay connected to them and communicate with them while they were out, just so they felt connected. So I think in general, COVID impacted the number of employees we can employ because of our business being slower and lower, and the promotional opportunities won't be as readily available as they used to be for a while.
And I think part of the question was related to specifically evictions that are happening due to COVID-19. And so do you have anything you'd like to add?
Yes. So due to COVID-19, pending evictions, it's still important for individuals to pay their rent. The great thing when you are in affordable housing, you can call in to do a research. So you might have been paying $351 for your rent and you lose your job. So now you're able to pay $50. And so, you know, when you're in housing, those evictions, you still have to pay. I think a lot of people misinterpret the announcement that had came out in South Carolina of not paying your rent. That it's important to still pay your rent during this time. The way that we have really seen it impacting families now is that they're now able to go back to work. So a lot of employers that they had, they're not able to go back, but they don't have childcare. So this is where we're seeing some of the biggest impact, because some daycares are not open, or they're only taking small amounts, or if they have multiple siblings, maybe who normally would keep their kids, they're unable to. So those have been huge changes. Everybody's also scared. So also the whole pandemic of COVID-19 has affected a lot of things. But as far as evictions, individuals still have to pay their rent, but it's also important that they call in for their recertifications. But also as they're getting jobs and they do the research, their rent doesn't go back automatically. So there's still some disallowances sometimes before it truly impacts them when they begin to get wages again. So they necessarily won't hit that cliff effect until it's ongoing, and we begin to be able to strategize with those families if they need assistance.
I think that's a great point in the way that childcare is so linked to employment. You know, one, the ability to afford it, which is a lot of what we've talked about, the voucher, and then being able to have the income and wages necessary to pay for your kids to be in childcare. But I think that COVID-19 has also created an availability and accessibility issue as well, on top of the affordability. So many childcare centers have, been impacted just like any other business by COVID-19. So, there are a lot of challenges specific to childcare in our community, and it impacts a lot of different things. And so our Financial Stability Task Force at United Way of Piedmont recognizes that, and we're having conversations with people who work in that childcare space, who are experts in that field and leaders in that field in our local community, including First Steps and Mary Black Foundation and Spartanburg Academic Movement, to see how we might, one, address the affordability issue, but also the availability issues that we're seeing right now as a result of COVID-19. So there's still a lot of work to do, and a cliff effect is just a piece of it, but it's an important piece of this big puzzle. Somebody asked if there were a resource list of childcare places in Spartanburg County. I would say I would point you to the First Steps and the Quality Counts program for that information, and maybe we can send it out in the follow-up to this, or reach out to the person who asked that question. But I think that good resources, First Steps, Spartanburg County. I don't see any other questions at this time, but I do want to thank our guest speakers and our panelists. So Shanavia is not actually on the call, it was just a video, but I would like to make sure that we thank her. She spoke from a place of vulnerability to share that, and we really appreciate her taking her time to do that, as well as being so honest and open about her situation. So I want to thank Sierra with the Housing Authority, a great partner in the community, and we appreciate the work that you're doing to help families become self-sufficient. And then Jessica and Mira with Denny's, thank you both so much. It's great to have Denny's as a wonderful partner in our community in so many ways, and we really appreciate you sharing from your perspective as well. So I'll turn it over to Maria to close us out. And again, thank you everybody for joining us today.
Well, thank you, Hannah. You always deliver an excellent program. So thank you so much for thinking through this and sharing with us your expertise. Thank you also to Mary Narati and Alex, who have been behind the scenes, making sure questions get answered and computers work like they're supposed to. So I wanted to just mention that this is the next to the last part of the Women United Cliff Effect series. The last part is on advocacy, And advocacy is so very important in the long game here, because as Hannah showed, there's a lot of policy that needs to be looked at and addressed. And our first step at trying to address that is to help find maybe that 1, 2, 3 families that we can help go conquer the fear. I know we call it conquering the cliff, but I'd say conquer the fear, because I think families have learned more to live in the public assistance because that is where they're comfortable. That is where they can make ends meet. But we need to conquer that cliff. And once we do that, we can also help our legislators understand that and how policy needs to be changed in the state of South Carolina, so that it's not a constant request for cliff effect funding, but more so we have a better South Carolina. So with that, I will tell you that we're shooting to have an advocacy 101, because I'll tell you, before I worked at the United Way, I knew a little bit about advocacy, but I'll tell you, I've never been to the State House until I came work at United Way of Piedmont. So I've learned quite a bit since I've been here, but Heather Lothar, who heads up our advocacy work here, is going to be helping lead that. And we're looking at doing that in August, and it will be another virtual event just due to where we are with COVID-19. Ladies and gentlemen, I think that we are going to be able to end a few minutes early, and I hope that you can enjoy those few minutes. And thank you so much for your time. I will be sending out an email to all of you and a link to this recording so that you can reference it or pass it along. And that's the challenge that I would give you. What are you going to do with the information you received today? Because that's how we live united. Each of us taking one action from what we learned today and making us a better Spartanburg, Cherokee, and Union County. Thank you all so very much, and I hope you all have a great rest of the day. Happy 4th of July.